Moving on, we'll shift the conversation to take a look at a new patient experience, getting good, accessible healthcare to the world. We prepared a wonderful panel of speakers. It will be moderated by Ithanami Martinez from Doctor 24. Ithanami is the president of the Spanish Startup Association, the CEO of Doctor 24, and she is also teaching entrepreneurship and online marketing at several business schools. So please welcome her and the other speakers on stage, who she will introduce. Thank you very much.
Thank you for coming. We have great panelists today. They represent business models that are really, really changing the healthcare sector. So we have Adam from Sensely, coming from the United States. We have Anders from Cry. We have Maria from Social Diabetes, and David Masso from PromoFarma. And now they will tell you more about their own projects, way better than I will be able to do it. So I think I've launched startups in other sectors before, and I've been in the healthcare sector for 1 year now. I've understood why this is one of the sectors that is getting a little bit behind on innovation and disruption and everything. And it's because it's a very, very complicated sector. It's very fragmented. Entry barriers are really, really high. And at the end, we're working with things that really, really matter. If you have an e-commerce and you make a big mistake, your customer doesn't get the box. But if in our business models we make a big mistake, someone can die. It's like that. So I guess that's one of the reasons why e-health and healthcare is a market slower on getting innovative and disruptive. But it's also a sector where innovation is way more necessary than in others, because innovation, technology, and all of these business models that we are going to learn from right now help you give a better quality of healthcare assistance to a lot more people and making it cheaper than it was before, which is like the magic triangle of value. So enough of me. I manage Doctor 24, which is a telemedicine platform. We provide video consultations with doctors that they can diagnose you and give you a prescription like in 5 minutes from a phone, a tablet, or a laptop. We've launched it in Madrid like 1 year ago. And now I'm going to let our fantastic panelists to introduce you their projects, and afterwards we will go in deep on the challenges of this market. David, your turn. You start. Tell us about PromoFarma.
Well, I'm David Masso. I'm the CEO and co-founder of PromoFarma.com. We're a marketplace of pharmacies. So what we do is connect thousands of users that want to have a healthy style of life with tens of hundreds of pharmacies that have a big offer on their shop, and they can sell these products through our website. Basically, we are what we call the Amazon, because we are the Amazon of the pharmacies. But since you are dealing with people that basically are looking for a healthy style of life, we are not just a transactional e-commerce. We are much like relationship e-commerce, and we are innovating in a way where we are not just selling health products, we are also providing advice. We are connecting the pharmacist with this end consumer. We are connecting the advice of this local pharmacy with this consumer that needs sometimes some kind of advice because, for example, he has a problem on cholesterol, or he has a problem on the skin, and plenty of times this kind of contact is helping this in that way our platform. At this moment, we are just focused in Spain and Portugal. We have more than 250,000 consumers purchasing every 8 days in our platform and growing 2 digits. So that means that this kind of positioning is very interesting. I like to say that here are other business models that are dealing with patients. We are dealing with the people that are not still a patient, the people that want to take care about their health in order to avoid to become a patient. And in that sense, we are innovating also in bots, in apps that are helping these people to consume less medication in the future.
Okay, great. Maria, tell us about social diabetes.
Thank you. Well, thanks for being here and for this exciting environment. My name is Maria Salido. I am here as a CEO of Social Diabetes. Well, I could start saying that since I was younger, I was fascinated by the human perspective of technology. But when we started studying computing around 18s, technology was for, how could I say, special people.
Okay.
We had to wait till earlier years in the century to see how technology became social. And now I am fully dedicated on how technological advances, attitudinal shifts, and the ubiquity of personal devices are helping people with diabetes. We will talk later. Thank you.
Okay. Anders.
Yes, thank you. My name is Anders Helen, and I'm heading marketing and growth for a Swedish startup called Kry. We are trying to do primary health care better. We think there are so many ways that it is a little bit broken or have too much friction today. So far we're live in Sweden and have great traction and really making primary care more accessible.
Great. Adam.
Hi everybody, my name is Adam Odeski. I'm the co-founder and CEO of Sensely. So Sensely is a virtual nurse platform that helps doctors better manage their patients. Specifically, we focus on the chronically ill population in the United States. 5% of the population in the United States consumes over 50% of all the healthcare costs. Most of those healthcare costs are chronically ill people that have heart failure and diabetes and COPD and others, and so that's a big, big problem. So what we did, we built a virtual assistant, like an avatar, that is mobile first. It was purpose-built for deep patient engagement and to increase compliance. We're making patient interaction engagement simple, intuitive, motivational. So we built this virtual assistant that combines speech recognition, mobile touch, integration with medical devices like blood pressure cuffs, weight scales, pulse oximeters, and glucometers. And we've made all these different input points work together to have a very natural conversations with patients about whatever topic is of interest to doctors or physicians who are monitoring them. So it's used for triaging patients either to a call center or to an emergency room. It's used for, as I mentioned, chronic disease monitoring. It's used as a medication assistant. We've been deployed in the United States for the last few years. We're also deployed in the NHS in the United Kingdom and also in Japan and Netherlands. And since our avatar speaks multiple languages and speaks Spanish really well, kind of look forward to see if there's...
How many languages does she speak?
32 different languages.
Wow.
Yeah, so all the major European languages, Asian languages, and some
So
Middle Eastern as well.
This product that you have created, can you give us some specific examples on how it's disrupting the patient's experience, how the patients are improving their experience through this product?
Yeah, so it's very interesting. Let's take the population of patients that are 60 and over, a majority of those that have chronic diseases. They didn't grow up on the internet like we did or with early computers. They're very in general, they're very averse to computing. They're used to talking on the phone. They're used to talking face-to-face. And that sort of experience is what we found when people talk to our virtual assistant, virtual avatar. That sort of empathy, that sort of trust, that sort of honesty is measured through the conversations that people have with the avatar. That increases compliance because patients are actually interested in coming back and talking to it every day. And because we're motivating the patients to talk to it every day, we're able to collect a much larger set of data, process that data, analyze it for risk, and immediately notify clinicians to take immediate action. That's what helps people from going to the hospital, especially chronically ill patients. We can recognize that risk much quicker because we built that relationship with the patient.
Great. Anders, how does your service help patient to have a better experience?
I think in many ways, I mean, Kry is a company that's founded not by doctors, but by patients. So we're really tired of all the friction, especially in primary care, you know, at least in Sweden, but in many European countries, there are long waiting times getting into primary care, and you have to book an appointment, you have to sit in the waiting room. Even if you have a certain time that you booked with your doctor, you have to wait another additional 30 minutes or an hour in the waiting room. And we just said that, okay, let's turn this on the head. You know, we can have much better efficiency and cater much better to the customer if we do this through a video platform primarily. So yeah, we started doing that. And the average waiting time today, if you're in Sweden, to get in from you open the app until you see a doctor is like 7 minutes.
Wow.
So we try to staff with enough doctors that you can open the app at any time and just, you know, see a doctor face to face, tell them about your illness. We see from the statistics that you know, our app is loved by the customers, and that we really improved. We get patients that otherwise wouldn't have gone to the traditional healthcare system because they think it's too slow, they're too stressed, and now they can get help with minor issues that they wouldn't have sought help for otherwise.
Great. Maria, how are you helping your
Yes,
patients?
as has been said, people with chronic diseases are alone almost all the time. For example, people with diabetes have to take decisions every day, at least every time they eat. So no doctors, no nurses, no protocol, no real help are with them all the time. Social Diabetes, for example, is a digital health platform that empowers patients to actively engage in their own care. And we have 3 main functionalities to do that. For example, one of the most important one is the system recalculates or calculates and suggests the proper insulin dosage according to the context of the patient at that specific moment, depending on what they have eaten, the sport they have been doing, the data collected from devices, the historical behavior of that patient. So they provide specific advices about medication. Social Diabetes also allows patients to be connected with their doctors in a real-time model, because this is interesting, because doctors can monitorize in real time what is going on with the devices on the hands of the patients, alerts, reminders, and a telemedicine suite of functionality are helping to make the process more efficient. And to finalize, we are providing patients Internet of Things ecosystem by connecting mobile devices with glucometers, wearable, smartwatches, signal vital sensors, and so on, to improve the quality of data and improve as well the user experience. In this sense, for example, we have been working we are involving in a most ambitious Internet of Things testbed program with NHS, which is very important from Spanish startup.
Yeah.
And this year we have signed as well 2 big contracts with Menarini and Abbott to promote the integration of their glucometers with social diabetes in order to improve continuously the user experience, because we are users, we are patients. My partner, the founder of Social Diabetes, is a diabetic person, and we are not defining the business as an industry point of view. More than this, we are focused on patients. And the reality is 400 million people are living with diabetes now. This number is going to increase to 600 million people by 2040. So it's the epidemic of 21st century. And the only way to keep these patients on a safely ranges and to keep the healthcare costs under control is to educate patients in their own care by providing technology, knowledge, and a smart social context. And that's why what we are trying to
Exactly, yeah. David, how do you improve patients' life at PromoPharma?
Well, we as an e-commerce marketplace, we
or pre-patients. You're pre-patients.
That's right. Okay, but basically, we are just not trying only to sell thousands of products every day to them. We also want to provide to them advice. And for that reason, now we are investing on content creation. We're investing a lot. At this moment, we have more than 2 million minutes of reading of content every week from our customers. That means that there is a lot of space providing advice. And right now we are creating a community of pharmacists that are providing this content to us. Video blogging, also they are helping to create these bots. And also right now we are creating even a magazine where we can answer to them in an interactive way all the concerns that we are detecting. We believe that in the next 2-3 years, e-commerce marketplaces like PromoPharma will become like not Dr. Google as doctors, okay, but we will become platforms to assess healthier style of life, and we are investing also in that line.
Great. Well, I guess that the resume of all of this is that technology, it's making healthcare accessible to people. Now you can see a doctor anywhere, anytime, like literally see that doctor. And even more, you won't need doctors that much when you have nurses, intelligent artificials that can help you through things. And you can prevent going to that doctor through social diabetes, platforms like social diabetes, or even PromoPharma with the content. So I guess the impact goes from before you start to get sick, well, you get sick and then you pre-jump. But there's also in this sector a lot of challenge, lots of challenges. So Adam, tell us what is the biggest challenge you're facing right now?
Yeah, absolutely. I think
We are going to be
and to
away.
your point, the proliferation of smartphones and devices all around the world have created essentially a market where you can start offering healthcare services to the world. And it's actually a really exciting opportunity for a startup to be in. The first digital health startups are actually coming out, have that sort of access now where they didn't have before. But in order to really penetrate the world, I guess, if you will, it's a humongous challenge in terms of regulations, in terms of workflows, the different opinions that different systems have, being able to create something that's flexible, that could be turned on and off, or which way to conform to the proper regulation system, to the standards, is a challenge, but also humongous, like a great opportunity that we must all pursue. And that's been a challenge for us, particularly.
Great. Anders, what's been your biggest challenge?
I mean, we really want to level the playing field when it comes to doctors and patients and how it works. And when you try to do that, of course, healthcare has been, for many hundreds and even many thousands of years, doctors have been in control. And recently, the last 100 years or so, governments are in control of the funding of the healthcare. And I mean, we do primary healthcare, so it's not super sick people. It's just like interacting with the patients. But for us, the challenge is really to level that playing field. We have to change a little bit how governments and how doctors and associations of doctors think about healthcare, because we believe it could be done in a much smarter and more efficient way with new technology. But yeah, we're getting some good traction, at least in Sweden, on that. But it's a lengthy discussions. So
At the end, we're like disrupting a market, and we're trying to get on the people's head, the top of mind, like when you feel sick, you don't need to drive to the doctor. You just have to take your phone and speak to him. So that's a very big change, behavioral change that it's going to be hard, but it's fun.
It's a cultural change.
Yeah, it's a cultural change.
We absolutely agree with my colleagues. Yeah. And I would add, there are a lack of integration of data, integration of personal health record. And this is a difficulty for global companies like us, because people are moving around the world more than ever now. And your data, your healthcare folder is just in your country. So the information must to move from a silos to a global integrated, in a personal health record, globally accessible. It will help not only patients as well as platforms or technology over this global, because finally patients are like customers in the information era,
Yeah.
consuming private services, public services, and their data must flow with the same logical that we are moving around the world.
We were the other day at the office discussing about this, all the data of the patients they have. You have you go to a hospital and then you can take that information to another hospital with you. And I think Estonia is the only country that they can they have fixed that like a lot. So we were thinking about solutions, and the solution we came with, we were like, okay, a zombie holocaust will be the solution for this. You know, when everything goes to crap, then we can build on top of it and do it right. Because right now is such a mess, but not only in Spain, in
It's
the
a
US.
stopper. It's a
too.
stopper for innovation because
Exactly.
you are constrained in a silo managing.
Yeah, I mean,
data.
it's a fundamental question in capitalist societies. How basically, what do you actually make the core that's a public benefit versus making competition kind of fight for that core? And it seems in the latest kind of revolution of health, particularly in digital health, the integrated medical record, a countrywide medical record, has become a sort of a necessity
Yeah.
to have for our society. So it's going to be an interesting sort of set of events in upcoming years to see how that resolves itself in the markets.
We were talking before about the prescription, and he was telling me that they have like electronic prescription in the public sector and in the private sector altogether. Here, well, you know, you can't. If you go to a private doctor, you get the prescription, and then you have to go to the pharmacy, but there's no e-prescription whatsoever. You can digitalize it. Right now we're fighting because we're going with a PDF on the cell phone, and the pharmaceutical guys are saying, no, bring it signed by the doctor in paper, I need to check it. And it has a barcode, but they need the paper for it. What challenges are you finding?
Well, we have plenty of challenges. I would say we have business challenges, regulatory challenges. In terms of business, basically now we have 1/3 of the market in Spain, and in the next 2-3 years is a market that is going to have a turnover of 1 billion just online euros in Spain.
Wow.
So we want to keep our path to keep
Stay there.
and stay there with our market share. That's very important, and that's the reason that we're investing and innovating so much. And the second is in terms of regulatory. In Europe, every country are allowed to sell different kind of products. For example, here in Spain, it's possible to sell consumer health products. But in the UK or Germany, also you can sell medication online and connect doctors with the online platform to sell these products. So this is going to be really a very important challenge. And let's see in the next 3-5 years to have a unique market, a European pan-European market, how evolve in that way these platforms.
Cool. Now let's think about the future. Let's play to be the Elon Musk of healthcare. And please give us, each one of you, a tweet of how do you envision the healthcare in the next, I don't know, 5, 10, this is a slow market, but 10, 5 years. Be Elon Musk, please, Adam, for us.
Maybe to follow on what my good friend Mark Perez said in the previous session,
Okay.
let's hope we can live forever, but
Okay.
if we do, let's be happy and healthy.
That's a great tweet. Fantastic. Anders?
I mean, the way I vision it is there's two things that are important in the future, and hopefully in like a 5-year time frame, which is that the patients are in control of the data, of the healthcare, of how they get treatment, so it's much more equal, and that it's much more proactive, that you don't have to wait to get sick. Healthcare should be proactive and patient in control.
Okay. Maria?
Well, I don't know, but maybe health is a basic human right. And the costs are increasing and increasing because we are becoming developing countries, everybody, and this is a tricky financial situation. Maybe technology could help to make health more really universal and really accessible for everybody in the world. If Facebook are working to provide internet to everybody, health must take advantage of this spirit, technological spirit, and to make all people to have this human right, basic human right, to have data, to have technology, to be safe and to be accurate with
Great.
health.
David,
Well, a tweet.
you can go longer. We have time. You can go
Okay,
longer.
well, but
too.
basically, the motto of our company is basically be healthy and you will be happy.
That's another great tweet also. So we have a few minutes left. Tell us what are the next steps of your company. What are you focusing? What do you want to do next? Your next thing.
We're definitely investing a lot of the money that we raised into artificial intelligence and machine learning. Not just to, like a lot of remote monitoring systems today, you follow up with patients. The protocols for those remote monitoring systems are fairly static across patient populations. In diabetes, there's certain standardized thresholds for different glucose levels. In heart failure, you have different blood pressure measurements. But every human's constitution is different. Everybody has different thresholds. So what we're investigating and what we're developing are ways, the more like you talk and interact with a person, the more you understand about that person and the various kind of events that take place in their life, the better you're able to adjust your risk profile for that person to better understand when they're at risk and what they're not risk. Because ultimately that benefits the healthcare system as a whole, because you want to optimize the amount of hours and minutes that doctors and nurses spend on treating patients. You want to make sure that when a patient goes in or it's an important risk, there's a treatment that is relevant for that specific patient. So learning more about that patient, what sets the risk, is one of the key technologies that we're building.
In one of these conversations, sometimes come up the idea of a world without doctors or with less doctors, thanks to artificial intelligence. Do you have any thoughts there?
Yeah, I do. Just 1 second. I mean, it's kind of a controversial topic, right?
Yeah.
To have a world without doctors, because arguably, the amount of information that a doctor learns, from medical school all the way through many years of experience is invaluable and really hard to teach, even with the computing system. But at the end of the day, math and technology kind of speak for itself. Artificial intelligence algorithms, machine learning algorithms are becoming sophisticated enough to make very complex decisions that's based both on experience as well as the standardized algorithms. And so theoretically, it's very much possible. I won't speculate on when it actually be, because I think the regulatory phase, let's say, is going to be much slower than the technology evolution phase of this.
Anders, what's next for CRI? I don't pronounce it right?
CRI, that's good.
CRI? CRI? Impossible.
Great name in Sweden, not so great name otherwise.
Okay.
But I think everyone at CRI is like serial entrepreneurs. Everyone started 2, 3, 4 companies before. Everyone is techies and we're patients. And still, we try to create the best patient experience. And it's much less about technology than we originally thought. It's to create the best patient experience and to decrease friction in all the steps to get to that patient experience. It's a lot about having good routines, training doctors, and decrease friction and increase usability when you use the product. It's technically not that hard, but it requires some thought.
Great. Maria, what's next?
Yeah, as of today, social diabetes is the most relevant app in Spain and Latin America. So we are the leaders in these markets. We are now using these successful pilots and successful market share to increase our presence in UK and in USA. So one of the next steps is to pass the FDA in order to reach that market.
Good luck with that.
In terms of product, I would say we have a very good product, but we can move from big data to artificial intelligence, because we are not calculating things by algorithms and exploiting data, but we want to be beyond this. We want to be very smart and provide users a really personal trainer about diabetes. And we are consolidating now very smart and ambitious team. And for do all these things, we are now raising capital.
Sounds great.
Base with some investors here in Spain.
Great. David?
Well, as next steps, we have mainly two. One related to operations. We sell more than 35,000 different products. Some of them are urgency products, so people want them very, very quick. So we are going to launch in the next few months a service that in just 1 hour in 50 different cities, you can just access to some of these products, because people, when they have a healthcare issue, they need the product very, very fast. That's one of the first next steps. And the second is much more related to also open our marketplace to very innovative products. Some of them has been presented to here. So products that need help to reach consumers, products that need help to reach mass market. We know a lot about the profiling of people purchasing different kind of categories in consumer health. So we can help these people in a special program to reach specific targets. So that's the second next step.
Thank you very much. Well, thank you very much for coming, everyone. And I hope you've enjoyed the panel. Thank you.